Thank you all for joining this webinar session, and thank you, Gage, for the introduction. I am Dania Abu-Alhaija. I'm a post-doctoral fellow and adjunct instructor at the University of Cincinnati College of Nursing, and I'm currently conducting research on occupational health nursing. In the following hour, I will present about chemotherapy safety among oncology nurses, and we will talk about chemotherapy exposure, health risks of the exposure, contributing factors, and prevention strategies. First of all, I would like to notify that this presentation includes the general recommendations and guidelines to prevent chemotherapy exposure in oncology settings among healthcare workers, but there are some types and forms of chemotherapy or even other hazardous drugs that need special handling precautions. So if you need more specific details, you can refer to resources published by NIOSH, OSHA, or sometimes your institution's guidelines. My agenda for the meeting today, first of all, I will introduce a brief introduction on the topic of chemotherapy exposure, then a historical background on the problem, the prevalence of chemotherapy exposure among healthcare workers and oncology nurses, as well the documented health complications of chemotherapy exposure at oncology settings. Then we will talk about safe chemotherapy handling guidelines at the primary and secondary prevention levels. We will talk about also some factors that influence chemotherapy exposure or influence nurses' adherence to the guidelines when handling chemotherapy and strategies to address these factors. And at the end, we will have a case study and a discussion before we open it for questions. I would like to start by defining chemotherapy exposure. Chemotherapy exposure is a serious occupational hazard that affects the health of oncology nurses and other healthcare workers. Chemotherapy exposure basically occurs during the procedures of chemotherapy handling, and it occurs through skin or mucous membrane absorption, inhalation, maybe hand-to-mouth ingestion, and or a direct injection with a sharp contaminated object. Initial concerns surrounding chemotherapy exposure and safety were first documented in 1970s when chemotherapy drugs had been related to developing secondary cancer among patients receiving them. Since that time, the need for practice guidelines regarding chemotherapy handling was emerged. However, it wasn't until 1986 when the first guidelines for hazardous drug handling were published. Since the publication of these guidelines, the exposure rates for chemotherapy decreased. However, this problem remains a serious condition affecting healthcare workers, including nurses, and it is demonstrated through the high rates of exposure to chemotherapy among healthcare workers and oncology nurses as well. We actually could not find national statistics on the prevalence of chemotherapy exposure among oncology nurses, but there are surveys and studies were done for this purpose. For example, according to the Centers for Disease Control and Prevention, about 14% of nurse respondents to a survey indicated that they were either exposed to chemotherapy through skin or experienced chemotherapy spills in the previous week preceding the survey. Also, in a study by Ferris et al., approximately 1 in 5 nurses reported being exposed to chemotherapy during the procedures of cleaning up chemotherapy spills over the past 2 years. Unfortunately, there is no minimum safe level of chemotherapy exposure. Therefore, exposure to chemotherapy in even in small amounts carries health risks. In fact, in a study to understand why nurses do not adhere to recommendations when handling chemotherapy, one of the main identified barriers was that nurses consider the exposure amount is minimal, and it would not hurt. And this is definitely not true. The health effects of chemotherapy exposure are serious, and they include infertility, congenital anomalies, pregnancy loss, genetic material damage, increased risk for cancer, organ toxicity, and also allergic reactions. There are studies conducted to assess the health complications of chemotherapy exposure among healthcare workers. For example, in a study conducted by Skov et al., a significant increased risk for leukemias was found among oncology nurses working in a Danish center. Also, an increased risk for leukemia was noted also among physicians who worked at least 6 months in oncology settings. Besides that, there is a moderate level of evidence indicates that chemotherapy exposure at work is associated with higher risk for abortion and genetic material damage. As oncology nurses handle several types of chemotherapy during a given work day, they are vulnerable to what is called a mixed occupational exposure. And we mean here by mixed occupational exposure is the combined effect of exposure to multiple chemotherapy drugs is more dangerous than the hazards associated with each drug individually. And this further intensifies the health risks associated with chemotherapy exposure among healthcare workers and oncology nurses. Unfortunately, several recent studies, even when we have these current guidelines for chemotherapy handling in place, these studies show that detectable levels of chemotherapy biomarkers were found in urine samples of healthcare workers, including oncology nurses, and urine samples and also blood samples. Both types of samples showed chemotherapy biomarkers. So what are the procedures of chemotherapy handling that might lead to chemotherapy exposure? These procedures are many, and they include receiving chemotherapy drugs. Even the outer packages or containers of chemotherapy drugs may have residue in them, so they are considered sources of chemotherapy contamination. Other procedures are dispensing, repackaging, or counting oral doses, tablets, or capsules. Chemotherapy compounding activities are also potential sources of chemotherapy exposure. And examples of these activities are crushing or splitting oral tablets, transferring chemotherapy drugs between containers, withdrawing chemotherapy drugs from a container, diluting a chemotherapy drug. Other examples are expelling air from syringes and drug transfer using needles. Both of these procedures may result in chemotherapy aerosol generation, and these aerosols may deposit on skin or environment and cause chemotherapy contamination. Other activities that or other handling procedures that may lead to chemotherapy exposure: administration activities to patients through various routes. Chemotherapy exposure occurs also if a nurse primes the IV set with chemotherapy instead of other solutions, as this would result in contaminated the surroundings. when chemotherapy drips from the tip of the IV set. Providing care to patients receiving chemotherapy can be a source of exposure to chemotherapy because chemotherapy drugs are excreted in patient secretions and excretions within 24 hours of receiving chemotherapy. So this secretion and excretion become sources of chemotherapy exposure. Chemotherapy exposure can occur also while managing spilled drugs, and we will come in the next few slides on the correct steps to follow to manage chemotherapy spills. Transferring the chemotherapy drugs within within the healthcare institution departments or units could result in chemotherapy exposure. Chemotherapy exposure can also occur while disposing chemotherapy wastes or during removing the contaminated personal protective equipment. Prevention of any occupational hazard occurs at several levels. Mainly we have the primary, secondary, and tertiary prevention levels. In a primary prevention level, we may have strategies to prevent the exposure from happening by implementing engineering control measures, using personal protective equipment when handling these hazardous drugs, or implementing administrative control measures. Also education and increasing awareness and training on how to prevent exposure to these hazardous drugs is also very important. At the secondary prevention level, there are strategies to screen for potential exposure and identify indicators of exposure or early diseases. At the tertiary prevention level, strategies aim to treat the complications resulted from the exposure. And in this presentation, we will focus on the primary and secondary levels of prevention. Engineering control. Engineering control means removing hazardous conditions or placing a barrier between the worker and the hazard. And to reduce chemotherapy exposure, this includes limiting access to areas where chemotherapy drugs are handled to authorized individuals. And all of these individuals, even if they are not healthcare workers, should be aware of the basic fundamentals and guidelines to handle chemotherapy. It includes also using signs, hazard signs, and chemotherapy identification drugs to identify the area where chemotherapy drugs are handled, and to identify also chemotherapy drugs themselves as hazardous drugs. Chemotherapy handling areas where chemotherapy are handled should be away from staff or patients' refreshment rooms. Specific areas should be equipped with special negative ventilation. Storage of chemotherapy should be according to safety precautions that prevent contamination, even in natural disasters. So chemotherapy should be stored in special cabinets that prevent contamination from these drugs. During the preparation or administration of chemotherapy, special transfer devices should be used, and these devices provide a closed system to transfer chemotherapy, so this reduces the chemotherapy leakage and contamination. Using personal protective equipment is another primary prevention strategies, and the personal protective equipment that is needed during chemotherapy handling are 2 pairs of chemotherapy-specific gloves, chemotherapy-specific gown, head, hair, and shoe covers. Sometimes you may need sleeves covers also. respiratory protection, and eye and face protection. Gloves. When handling chemotherapy, you need 2 pairs of chemotherapy-specific gloves. Regular examination gloves, even thick gloves, do not offer adequate protection and may permit chemotherapy permeation. These gloves should meet the standards of American Society for Testing Materials. These drugs also should be powder-free because powder may absorb chemotherapy and may result in chemotherapy contamination in the surrounding environment. Chemotherapy-specific gloves should have no pinholes or weak spots. Before applying these gloves, you should inspect the gloves for any defects or perforation or any tear in them. These gloves should be changed every 30 minutes while working or immediately when they are torn or penetrated. When applying both pairs of gloves, the inner glove should go under the gown cuff, and the outer glove should go above the gown cuff. This will prevent the leak of chemotherapy underneath the inner glove. When removing the double gloves, these gloves should be turned inside out, so contaminated surfaces do not touch the uncontaminated surfaces, and definitely hand washing thoroughly using soap and water before and after donning and removing gloves is essential. Gowns. Gowns help protect the workers from spills and splashes of chemotherapy hazardous drug and waste materials. These gowns should be chemotherapy specific with long sleeves and tight fitting cuffs, so it does not allow the pass of chemotherapy to the skin or to the clothing. These gowns should be disposable and never reuse gowns used during chemotherapy handling. These gowns should be made from material that does not allow the permeation of chemotherapy, and they should not be worn outside the preparation area, especially if they are contaminated with chemotherapy. Gowns should be changed every 2 to 3 hours during working or immediately after splash. Gowns should be removed with care to avoid contamination. And it's noteworthy that isolation gowns, lab coats, scrubs are not appropriate substitutes to chemotherapy-specific gowns. Other personal protective equipment that are needed, head, hair, and shoe covers. And these equipment help protect from contamination with chemotherapy residues. Sometimes the sleeve cover should be used to provide additional protection for areas of the arms that come in contact with chemotherapy during chemotherapy preparation. Shoe covers sometimes also shoe covers should be used, and sometimes you need double shoe covers in chemotherapy compounding areas, and shoe covers used in the preparation area should be removed before exiting these areas. Eye and face protection. Eye and facial protection should be used when handling chemotherapy or chemotherapy contaminated secretions and excretions when there's a risk for splash. Eyeglasses are not appropriate substitute to eye goggles to protect it from chemotherapy exposure. Face shield alone does not provide adequate protection to eyes, so face shields in combination with eye goggles provide a full protection against splashes to face and eyes. Respirators. Respirators are required in activities requiring respiratory protection. So when there's a risk to be exposed to airborne particles, NIOSH certifies N95 respirator should be used. But when there is a risk to be exposed to gases or vapor, higher levels of respiratory protection is needed in these cases. And definitely surgical masks do not provide the required adequate respiratory protection against chemotherapy exposure. So as you can see in this picture, this is a healthcare worker applying all the required personal protective equipment for a chemotherapy handling procedure. As you can see, this healthcare worker applies the head cover, face shield, eye goggles, the appropriate respiratory protection, chemotherapy specific gown, double gloves of chemotherapy specific gloves, also shoe covers and additional protection to lower legs. Administrative control, this is the third primary prevention strategy, and it includes implementing policies that support safeties, as well as setting safe operating procedures and standards. And these actually are the responsibilities of the employer who employs oncology nurses who handle chemotherapy. These measures include identification of hazardous sources in workplace by using identification labels in areas where chemotherapy drugs are handled, or chemotherapy identification labels on the chemotherapy drugs themselves. It includes also performing regular revisions of the most recent handling guidelines, the most up-to-date equipment and exposure prevention practices. They have also the responsibility to train workers on safe chemotherapy handling guidelines. And they also should maintain and check the functionality of the equipment that prevents the exposure. Employers also are responsible for conducting regular contamination assessment of the environment and regular cleaning, and also monitoring workers' adherence to the recommended practices and safe handling guidelines. Environmental control. Environmental control means conducting regular assessment and cleaning of chemotherapy contamination, and this includes performing frequent sample wipes testing for chemotherapy contamination in areas that are more likely to be contaminated with chemotherapy, like the biological safety cabinets where chemotherapy drugs are stored, in areas in the room which these devices are stored, chemotherapy administration areas, and any area with possible chemotherapy contamination or cross-contamination. Spills management. Chemotherapy spills management actually is not a simple cleaning up procedure, and it should follow the safe chemotherapy handling guidelines. So if you experience chemotherapy spills, you should follow the institutional policies on how to manage these chemotherapy spills. You should have the spill management kit available and stored in easily accessible location. This spill management kit should contain all the required equipment to manage the spill, and this equipment should include all the personal protective equipment, wiping pad, and waste bag, and maybe other materials. A trained worker should be responsible for cleaning the spills. All personal protective equipment, including certified respirators, are needed to clean spills, because some types of chemotherapy produce vapor at room temperature. So it is very important to use respirators while cleaning up spills. Signs should be used to restrict access to these areas where the chemotherapy drugs are spilled. So what if I accidentally exposed to chemotherapy? So if you experience chemotherapy exposure through skin, you should remove the chemotherapy contaminated personal protective equipment or clothing immediately. You should wash the contaminated area thoroughly with water and soap. If you experience chemotherapy exposure through eyes, you should flush the eyes with water for 15 minutes. And if you experience chemotherapy exposure through ingestion or inhalation, you should address any acute symptom immediately, and these symptoms may include allergic reaction or other types of reactions. In all exposure incidents, you should review specific instructions for the drug that you have been exposed to on what to do if you experience exposure to this drug. And finally, you should report to your employee health and safety or any equivalent entity in your institution. Medical monitoring programs. Medical monitoring programs are part of secondary prevention strategies, and they are used to detect chemotherapy exposure. These programs should be available to healthcare workers where chemotherapy is handled, and healthcare workers from their side should participate in these programs. These programs include tracking the medical history and records of exposure to each of healthcare workers who are responsible for chemotherapy handling. They include also performing assessment of symptoms of exposure, physical examination, urine and blood lab testing. Based on the results of the examination and lab testing, follow-up interventions may be recommended if levels of chemotherapy contamination are detected. So despite the presence of chemotherapy handling guidelines, nurses still experience chemotherapy exposure. So it's worth it to know what are the factors that influence chemotherapy exposure among nurses. We conducted a review of the literature to understand the factors that influence chemotherapy exposure among nurses. And based on the findings of this review, these factors are classified to personal and environmental factors. Examples of personal factors are nurses' knowledge on chemotherapy exposure and chemotherapy safe handling guidelines. Also, nurses' adherence to use the personal protective equipment when handling chemotherapy. Studies show that most nurses use chemotherapy-specific gloves, but fewer nurses use respiratory protection or face and eye protection. Another important personal factor is nurses' health beliefs regarding chemotherapy exposure, such as the perceived risks of chemotherapy exposure, the perceived self-efficacy to use the personal protective equipment, or the perceived barriers to use these personal protective equipment. These health beliefs actually were found as very important determinants of nurses' adherence to the guidelines when handling chemotherapy. And some studies show that nurses' health beliefs are what influence the adherence to the guidelines, not the knowledge on chemotherapy exposure itself. Because some nurses may have high knowledge on chemotherapy exposure and chemotherapy safe handling guidelines, but they don't perceive that they are vulnerable to the risks or health risks of chemotherapy exposure. Workplace-related factors are important determinants of nurses' exposure to chemotherapy. And an example of a workplace-related factor is high workload. With higher workload, nurses are less likely to adhere to the recommendations under time pressure. Another workplace-related factor is the presence of cues to adhere to the guidelines in the work environment. And these cues could be chemotherapy identification labels, signs, and posters on chemotherapy handling guidelines. Presence of institutional policies that reflect the current and most recent guidelines on chemotherapy handling precautions, using a closed system transfer devices when preparing and administering chemotherapy is also a workplace related factors. Some nurses reported that they don't use these systems because these devices are either not available to them by the employer or they have functionality problems. A presence of medical monitoring programs is also very important. Interpersonal influences were found as factors that influence nurses' adherence to the guidelines. For example, nurses are more likely to adhere to the guidelines if their peers value the adherence to these guidelines. Finally, working in a supportive environment is among the factors influencing the adherence to the guidelines when handling chemotherapy. So what are strategies or what you can do to address these factors? First of all, you should participate in continuous education and training on safe chemotherapy handling guidelines. You should promote your health beliefs toward the adherence to these guidelines through education and training and self-education of yourself on the health risks of chemotherapy exposure. You should adhere to using the personal protective equipment and other equipment during preparation and administration to prevent the exposure to chemotherapy. You should report any functional problems with the equipment that reduces the exposure to chemotherapy. Washing hands before and after chemotherapy handling procedures is very important. Chemotherapy contaminated personal protective equipment should be disposed appropriately, and chemotherapy specific personal protective equipment or preparation administration equipment should be stored in easily accessible location in oncology settings. Standardized signs and alerts should be used in oncology settings to identify chemotherapy compounding areas or chemotherapy handling drugs. Also, you should work to maintain a supportive working environment for you and your co-workers. You should value your peers' adherence to the guidelines when handling chemotherapy. And finally, I would like to notify that following the guidelines will not only protect yourself from chemotherapy contamination, but also will help protect your co-workers and prevent work area contamination with chemotherapy. These are suggestions of useful resources that you may refer to if you want more specific details on chemotherapy health risks or chemotherapy exposure, chemotherapy handling guidelines. You can refer to USP General Chapter on hazardous drug handling, the publications from Occupational Safety and Health Administration, National Institute for Occupational Health and Safety, and also publications from Oncology Nursing Society. This is a case study. It helps to apply the knowledge that is presented in this presentation into a real situation. So in this case study, I have Erika, who is a 25 years old female, works as a registered nurse in an outpatient oncology setting. She regularly administers chemotherapy to her patients. Last week, she was preparing an IV chemotherapy infusion for her patient. She was wearing an isolation gown, double pairs of chemotherapy-specific gloves, and an N95 respirator. While she was priming the IV set with chemotherapy drugs, large amount of chemotherapy is spilled into her gown and leaked under her inner right glove and resulted in direct skin exposure to chemotherapy. So my question to you for this case study, what are the next steps that Erica should follow? So I would ask you and let you answer this question. So she exposed to chemotherapy through skin. What the immediate next step that she should do? Okay, so she exposed to chemotherapy through skin. She has a contaminated gown and gloves. So the next step should be should she keep the chemotherapy contaminated personal protective equipment? Definitely no. She should remove the personal protective equipment that is contaminated with chemotherapy. Then she should thoroughly wash her hands with water and soap. After that, she should review any specific instructions that are specific to that drug on the steps to follow when the person experiences exposure to this drug. And definitely she should report to the employee health and safety department in her institution. So what are practices that contributed to the exposure? I want to return to the previous slide. So to remind you of some mistakes that she made. Okay. So what do you think the mistakes that she made while she was preparing chemotherapy? Do you have any idea? I think you can. Gage, do I have to unmute?
Folks are muted right now, but if they would like to talk, they do need to just hit the unmute button on their.
So they can hit the unmute button.
Yep.
Okay.
It doesn't really tell us, but did she have her gloves on correct? You know, the first one goes on under the gown, right?
Yeah.
And then the second one should have, then the second one should have gone over the top, right?
Yes. Yeah.
Right.
I mean,
Yes.
we don't really know that from reading this, but
yes.
Thinking that was the way it leaked in, was through not proper gloving, I guess you'd say.
Right, and you answered the next question on how she should apply both pairs of gloves. So if she applied the inner gloves under the gown cuff and the outer glove above the gown cuff, she would not experience that chemotherapy exposure.
That's
so
right.
This is one of the mistakes that she made. What are other mistakes? So she was wearing isolation gown. Do you think isolation gowns an appropriate substitute to chemotherapy specific gowns?
No.
Exactly.
Yeah.
She didn't have a proper gown on. Yes.
Yeah, she didn't have the appropriate gown, and she also did not apply all the personal protective equipment required during duration of chemotherapy, even if she was using some types of special cabinets during preparation of chemotherapy are not substitute to personal protective equipment. And what do you think about priming the IV set with chemotherapy drugs? Was this a correct action to do while preparing chemotherapy?
I believe that IV should have been primed with something like normal saline. And then the infusion started after you've primed.
Right. Right, and this is actually one of the major reasons why she was exposed to chemotherapy, because she was priming with the chemotherapy drugs, and chemotherapy drugs, it drip from the IV set tip, it contaminates the surroundings. So this was another mistake that she made while preparing chemotherapy.
It says a large amount of chemotherapy. Are
Yeah.
there regulations on how much is like a large amount? You know what I'm, like, it sounds like she had this big bottle or something, and maybe she shouldn't have been handling that type of vial.
Yeah.
But
Yeah.
there's no regulations on that, I guess.
Yeah. Yeah, large amount, because actually it came from the IV set while she was preparing, while she was priming the IV set. Sometimes you don't have control in the amount that it drips from the tip of the IV set. So what types of equipment that could be used to prevent chemotherapy spills? So in this case, what types of equipment that she would use to prevent chemotherapy spills? Think about the preparation cabinets. There are specific preparation cabinets to chemotherapy, and also the devices that chemotherapy specific transfer devices. These devices does not allow the leakage or contamination of chemotherapy, and they are doing a great job in preventing chemotherapy contamination. Okay, great.
She needs a refresher course.
Yeah, continuous education and training is very important. So I have here 2 discussion questions to generate just your thought. So what are factors that may affect the extent of chemotherapy exposure? So if maybe affect the extent and the health risks of chemotherapy exposure, what do you think the factors that may affect that?
Well, because tend to think of myself as an educator, I think one of the first things is proper education before you start doing any chemotherapy infusions. And, working with a colleague who is an expert in the area before you start doing your own thing. The nurse you gave us in the case study was a young nurse, and probably didn't have as much experience as some of her colleagues. And I think that's where a lot of individuals come in play.
Yeah, you're right. And I actually, I started to see that some oncology settings require that newly hired oncology nurses have experience at least 1 year in any other place before starting working in oncology settings, because this chemotherapy exposure risks add more burden and more types of work and protection measures on nurses. So what are other factors? So you said experience, yeah. So nurses who have longer experience may have more exposure to chemotherapy, more exposure incidence to chemotherapy, and this may affect the health risks of chemotherapy exposure on them. Also, what about the amount of chemotherapy exposure? Do you think the amount matters? The amount, the larger amount, definitely it's rationally expected that the larger amounts of chemotherapy produces more health risks than small amounts of exposure. The time that chemotherapy stays on skin affect the extent of exposure.
That's right.
Yeah, if you wash your hand with water and soap immediately, you will get rid of a large amount of chemotherapy deposit in your skin. But if this amount stays for a long time, the extent and health effects of chemotherapy exposure would increase significantly. So my second question, are people who work in oncology settings and are not directly involved in chemotherapy handling procedures, such as dietitians, social workers, are these people at risk to be exposed to chemotherapy, and how? So do you think these people could be exposed to chemotherapy even though they are not directly involved in chemotherapy handling procedures?
Well, the fact that the nurses they need to wear an N95 tells me that anybody, you go in, the social worker goes in to try to solve an issue with them, they could be through inhalation.
Yes.
I have not been on a chemo unit in years and years, but I don't remember all of them wearing N95s at that time, so I'm out of touch with that. But do they now?
Yeah, you are right. They are at risk to be exposed to chemotherapy. And actually, there are there are studies on, but not in the USA, on indirect exposure to chemotherapy among healthcare workers that do not have direct contact with patients or chemotherapy handling procedures. And these studies show that those health workers, so they actually did wipe sample on their skin, and chemotherapy residues were found deposited on their skin, although these workers were not involved, as I said, in chemotherapy handling procedures or any contact with patients. So what do you think the reasons, how do you think do these workers exposed to chemotherapy?
Well, if they're inpatient and receiving chemo, just touching the bedding could provide an exposure. Touching the individual, without gloves, touching any part of that room could provide an exposure.
Yeah, definitely right. Yeah. So exposure to chemotherapy could occur in these cases from cross-contamination. So imagine that a healthcare worker who is directly involved in chemotherapy handling procedures, and while this healthcare worker was preparing chemotherapy, then he used the department phone without removing the gloves, or used the computer. He typed in the computer. This would cause a cross-contamination with chemotherapy. So any other person who may come and use the computer or use the department phone will be exposed to chemotherapy in this case. Yeah, so cross-contamination is a big problem, and it could be more dangerous actually than the direct contamination, because a person who is exposed to chemotherapy through an indirect way may not be aware that he or she was exposed to chemotherapy, so he may not. So he or she may not have a reason to wash his hand or remove a contaminated clothing.
I was thinking the PCA person should be wearing the same PPE that the chemotherapy nurse would be wearing all the time. You know, like they're doing the body fluids and stuff like that. They have those double gloves on too.
Good point.
Yeah. In addition to following the standard precautions, those personnel should follow chemotherapy handling guidelines when handling patient secretions and excretions. So do you have any ideas or the most common places that may cause cross-contamination? For example, department phone, chemotherapy, computer keypads. So do you have or do you think of any other areas that are more likely to be contaminated with chemotherapy through indirect ways of contamination? during the normal practices of healthcare workers. Maybe chair arms, door handles. Yeah, these are.
As you noted, basically anything in that room can provide cross-contamination.
Yeah.
And that includes the doorknobs going in and out of the room.
Chemotherapy infusion pumps could be also a source of indirect chemotherapy exposure, because oncology nurses should not use the pumps while wearing their contaminated gloves. So if they are inside the patient room and they use or click on the numbers on the chemotherapy infusion pump, this may contaminate the pump with chemotherapy. Using other equipment like pin lights or the crushing equipment in the patient room for medication, while wearing chemotherapy contaminated personal protective equipment would cause cross contamination with these drugs. These are my references for this presentation, and I will open it now for questions, if you have any.
Hi, Dania. It's Carolyn Smith. I don't have any questions. I just wanted to compliment you on a very thorough and informative education program. I am not an oncology nurse, and so as an occupational health nurse, it's really important for me to think about some of the nuances that certain healthcare workers have, depending on the type of setting that they're in, type of patients that they're treating. So I thank you for this really informative presentation.
Thank you, Dr. Smith. Thank you very much.
Yes, I agree. A lot of good information for us non-oncology nurses.
Thank you. I'm happy to hear that. Is there any oncology nurse here with us in this webinar session?
I cannot no longer call myself an oncology nurse, but I spent about 15 to 20 years as an oncology nurse, doing both direct patient care and doing education. And this was a very good presentation. Thank you.
Thank you. Nice to meet you.
I was going to say, it doesn't look like there's any other questions. So I just wanted to take a moment to say thank you so much for this presentation, Dania. I think you're, like I mentioned before, the perfect person for this topic, and you presented a very fabulous presentation for us all today. So thank you so much for your support.
Thank you so much. I'm happy to be here today. Thank you.